Well, anytime somebody new comes to town, a call to action and our associates in the business community and other parts of the community, feel like it's our responsibility for that person to be welcome, particularly if it's a dynamic person who brings a lot of qualifications to our community and who feels a great need. So I'm more than a little honored to welcome to Macon and to talk to for a chat with for a few minutes Dr. Sandra Moore, who is the designated institutional officer for Navicent Health. Welcome to Macon.
Thank you so much for this wonderful opportunity to come and talk to you and the people of Macon.
Yeah, and I understand that you just got all kinds of experience. Well, let me tell you this. When you first came in, though I had met you before, and I saw you, I thought you were an intern or something. You just looked so young, which is good. I guess you got your degree when you were 9 or 12.
When I was 9. As long as people don't tell me I'm the old doctor in the room, I'll take that as a compliment. Absolutely.
Yeah.
But thank you so much for the warm welcome.
Tell us a little bit about yourself.
Well, as you said, my name is Sandra Moore, and I am a board-certified pediatrician. And I've been practicing pediatrics for about 15, 16 years. I am originally from the Baltimore area and actually did all of my training in Baltimore, both my undergrad medical school as well as my pediatric residency training. Now, when most people complete their residency training, they usually go out in private practice and they see patients. Well, one of the things that I did is I actually stayed in a training environment to help train residents and students after me.
Wow.
So I've really spent my entire career not only seeing patients, but also training medical students and training residents to go into pediatrics.
A lot of people don't understand the residency element of becoming a doctor. Talk a little bit about that.
Absolutely. I'm the first in my family to actually go to college. So going to medical school and residency, I really had no clue. Now, a lot of people watch TV, and there's always a good show on about hospitals and a resident, but most people really don't have a good idea of how one becomes an independent practicing physician. So first, you must complete college. Typically, it's 4 years. Then you must complete medical school, again, typically 4 years. Now, once you graduate medical school, you are a physician. However, you're not able to practice independently within any state. So the way that physicians are able to practice, like most other professionals, we have to be licensed. So in order to get a license, physicians really need to complete or must complete at a minimum an internship in some states, but in most states, you have to complete what we call a residency. So once you graduate medical school, we all have the same basic knowledge. We learn about the body, we learn about disease, we learn about medications. But once you decide, I really want to treat children,
Right.
that residency in pediatrics is typically 3 years, and some residencies are longer.
Wow.
They really allow you to hone in just on that population. So we spend another 3 years supervised by physicians actually practicing pediatrics.
So that's the residency.
That's a residency.
And then it could be in pediatrics or geriatrics or just whatever you want to specialize.
You could be in pediatrics, internal medicine. There are probably 90 plus residencies that one can complete.
Wow.
Even after residency, people can choose to subspecialize even further.
Right.
So I could have done another 3 years if I wanted to only do pediatric cardiology
Right.
or pediatric infectious disease. So
Right.
those are called fellowships even beyond residency.
So a lot of people do not realize that if one, is a practicing physician, they are your age, then they spend half of their life in it. Just kidding, but it takes quite a few years to become really to go through the college and then through medical school and then through the residency. So you got some years invested in that.
You absolutely have years invested. For most people, it's also a significant financial commitment as well to remain in school as long. The last part of the journey to really being an independent physician is also getting your board certification. So we hear a lot about board certified
Right,
physician,
right.
board certified physician. But typically, only physicians who have completed a residency in their specialized training are then eligible to take a test known as the board exam, and it's for each specialty. And if you pass that exam, well, now you're board certified.
Right, but you have to pass that exam. So everybody is not. I noticed that some doctors use board certified and some do not. So it's not automatic once you go through residency.
Absolutely correct. So once you complete residency, you are something called board eligible, meaning you can take the test. You have completed residency and are able to take the test. That's board eligible. And once you pass the test, that is when you become board certified.
Right.
Now, in addition to becoming board certified, most specialties require you to do lifelong learning to even maintain your board certification status. So once you take the test, it's not over. Experiences, modules, training that we must continuously do to even maintain our board certification.
Well, I understand that because, wow, everything is changing so fast, technology and information and science and
Absolutely.
things.
And not only is it changing, the public has access to a lot of that information. So patients are very savvy. They are Googling for information. So when they come to the office, they also expect the doctor to know what's going on in Google as well.
Absolutely. Well, let's talk about, I'm sure this is a call to action.
A call to action.
I'm your host, Alex Tabashi. I'm interviewing Dr. Sandra Moore, who's the designated institutional officer for Navison Health. A couple more things I want to talk about.
Sure.
I want to welcome you to the community again.
Thank you.
Let's talk about a little bit, talk to young people about going into science and medicine because, in some areas, I don't know whether it's nationwide, but I know in rural areas there's a shortage, but I think we want to encourage young people to go into medicine. It's taxing, but it's also rewarding.
Absolutely. There is enough room for everyone in all types of professions within medicine. So everything from physician to nursing to what we call our allied health that supports medicine. When you look at what we call STEM, so your science, technology, engineering, and math, in general in this country, we're in a big need for people to fulfill those jobs. So I tell people, healthcare, you always have job security. And it's unfortunate that, most young people tend to shy away from those areas in school or college. But it's really important that we think about those as career and all the career opportunities. One of the things we talk about a lot, well, it's not talked about as much, is something we call health disparities or really health equity. And what that means is that different people having different outcomes, although they have the same disease, because they may be different in some type of way. The people are different. So you look at men and women, you look at minority versus non-minority people, and you take something as simple as heart disease. Well, we know, for example, men tend to have better outcomes if they have a heart attack than women. We know that minorities, especially African American, tend not to have as good of outcome for things like heart disease and diabetes. And when you look at who is treating people, we really want to encourage people who are in those communities, who are going to go back and practice in those communities to, pursue health professional degrees.
That's very outstanding. Well, now what does designated institutional, I know it's a long title. Talk to us a little bit about your responsibility, not only as a DIO, but what other kind of functions, are you part of at Navison?
So probably no one outside of academic medicine, as we call it, knows what a DIO is. But as we've talked about, all physicians must go through a residency training program. If an institution sponsors these residency programs, there has to be strict oversight and management, not only of the programs, but also of the hospitals to make sure they are doing what they're supposed to do and supplying the resources for the residency training program. So the DIO at a hospital serves that function. So for Navison Health, I'm the person that makes sure that the institution has the support it needs for its residency programs, and also make sure that we have oversight of what's happening in the programs as well.
Right. I noticed you wrote a book.
Oh.
And I think it's a very important book. Tell us about the title and the motivation for the writing of that book.
Yes, so Scale Back Childhood Obesity. As a pediatrician, that's something that we see a lot of these days, really talking about child health and preventing, especially adult onset disease. So when I went into pediatrics originally, probably about 15 years ago, it was very rare that we saw what we really consider to be adult diseases. High blood pressure, diabetes, or type 2 diabetes, which is typically in adults and is weight related. But over the years, we've gradually seen this increase, especially in diseases that typically only once affected adults. And they typically affect children because of their weight. So you think about type 2 diabetes, when you think about high blood pressure, when you think about high cholesterol, I mean, honestly, these used to be old people diseases, for lack of a better word.
Watch them out.
I know. But now we're seeing it in the 6-year-olds, the 9-year-olds,
Wow.
the 12-year-olds. And it's a big difference when you get this disease, for example, type 2 diabetes, when you get as a very young person who's really starting out as an older person.
Wow.
And so the motivation to write the book really was to bring, one, awareness of being overweight and the health implications, but also to talk about how you can make healthier choices to improve your weight or improve the outcome, especially for children. It's not about cosmetic appearance. It's not about, how you look or really fit in your clothes. For us, it's really talking about how can we prevent or delay some of these diseases so that children, young adults can really live life to the fullest.
That suggests relates to what one can do in an effort to delay it or prevent these adult diseases in children?
Well, I think, it all starts with trying to have a good diet and a balanced diet. And so many of us have heard it previously, making sure we eat a lot of fruit, a lot of vegetables, really trying to limit the amount of sugar sweetened beverages. I know that's very big in the South, but sweet tea and other sodas and drinks can be some big culprits. And small things add up over time.
Right.
So really just being conscious of what you're eating, trying to make small changes, and trying to make more small changes once you've been successful.
Now you think, and I'm sure you would agree, that it's the parents' responsibility to become educated on what needs to be done in an effort to prevent and address, childhood obesity. Now, before you answer my question, is the book available?
The book is available on Amazon.
And I know you're not here to try to sell it. And
Right.
You didn't know, well, disclaimer, you didn't ask me to ask you this, okay? So go ahead.
But the book is available on Amazon. Yes, it is.
Now, the title of the book is?
Scale Back Childhood Obesity.
Scale Back Childhood Obesity by Dr. Sandra Moore.
Correct.
Is that correct?
Correct. Kathy Earls, yes.
Yeah, okay. This is a call to action.
A call to action.
I'm your host, Alex Habersham, having interviewed Dr. Sandra Moore, who is the DIO for the Navison Health Medical Center. I want to thank you, for coming. It's just very exciting to see someone come into our community with your qualifications, with your enthusiasm and your interest, and we really appreciate your coming. And if there's any way, any of us from this community can assist you in what you're doing, you just, I'm as close as your fingertip. Okay?
Thank you so much.
You're very welcome. This is a call to action.
A call to action.
I'm your host, Alex Haversham. HOST spells host. Have a great day.
Bye-bye.